right, so now let's look at part 2 of chapter 11, where we're going to look at muscles and their actions. So guys, when we're looking here at the facial muscles, we have a number of different muscles. We have the occipital frontalis. This is going to contain the epicarnus frontalis and the epicarnus occipitalis. We have the orbicularis oculi, which is a sphincter. We also have another sphincter on our face called the orbicularis oris, the zygomaticus major, the buccinator, the platysma. We also have muscles that move the mandible, which are the masseter, the temporalis, and muscles that move the head, which is the sternocleidomastoid. So let's take a look at where these are located. So this back muscle that we see here that's right on your occipital bone is going to be the epicranius occipitalis. On the other hand, when we look at the one that's covering the temporal bone, this is going to be the temporalis. All right, so you see why we learned certain bones? Because the muscles are going to coordinate. We also see this particular muscle that runs down the neck, which is going to help you move your head, is the sternocleidomastoid. Okay, the one that's flat on the neck is going to be the platysma. We have this one that runs right here in the cheek. This is going to be the masseter, so it's going to help you be able to chew. And when you tighten your cheeks, when you tighten up your jaw real good, you can feel your masseter right here. We also see that we have this one that is a little deeper, is also going to help with chewing in a sense, and it's going to be the buccinator. It's going to help with movement of the mouth, but it's going to be deeper. We also see that we have the one that comes and attaches to the zygomatic bone. This is called the zygomaticus major. So it's going to go to the corner of your mouth up to your zygomatic bone. We also have the one that goes around your lips, which is going to be the orbicularis oris. Around your eye is going to be the orbicularis oculi. And the one that's up here on the forehead on top of the frontal bone is going to be the epicranius frontalis. All right, so this is going to be their locations. Now let's look at what their action is. What do they do? Okay, so when we look at the flexion of the neck and lateral rotation of the head, this is going to be an unpaired action. This is going to be the sternocleidomastoid. So this is going to allow us to be able to turn the head from side to side right here, this muscle that you can see right here. That's going to be unpaired. But if we do flexion of the head down, it's going to be both of them pulling together. Okay, so what we're going to do is we're going to look at the rest of these with the actual picture. Okay, so flexion of the neck, lateral rotation of the head, the unpaired action is the sternocleidomastoid, which we already talked about. The one that closes the mouth, purses and protrudes the lips is going to be the orbicularis oris. So this is going to allow you to close your mouth, but also purse and protrude the lips. Raising your eyebrows and wrinkling your forehead is going to be the epicranius frontalis. The one that pulls your scalp posteriorly or back is going to be the epicranius occipitalis. The one that draws the corners of your mouth laterally and superiorly so you can smile is going to be your zygomaticus major. And the one that draws your lip down in a pouting movement, like this pouting movement, is going to be the platysma. So it's going to pull down in that pouty movement. The one that closes your jaw and elevates your mandible is going to be the masseter and the temporalis. So these two are going to work together. The one that compresses the cheek when you chew, suck, or blow, or even cause like a whistling sound is going to be the buccinator. So being able to and draw the cheeks in is going to be the buccinator. The ones that close your eye and allow you to blink, wink, squint, and pull your eyebrows down are going to be the orbicularis oculi. All right, so this is looking at their action. So we looked at their location, now we looked at their action. Now, when we look at some of these guys, some of these are considered a sphincter because they go around an opening. Others are going to be for mastication, which is what we call chewing. Bell's palsy is what happens when the nerves can't communicate with the muscles in your face and it causes a drooping to take place. Okay, and also when we look at this, we have more muscles that help pull your jaw up and hold it because when those are not contracted, your mouth stays open. This is why a lot of people, when they have that kind of just relaxed face, their mouth is slightly open due to gravity. It's like that. Okay, we have to engage the muscles in order to close the mouth. All right, so let's look at the application of origin and insertion. So when we look at the masseter is going to have the origin on the maxilla and the zygomatic arch. Okay, so you can see that it has the origin here. The insertion is going to be on the mandible. On the other hand, the temporalis has its origin on the temporal bone and in its insertion on the mandible. So recall from part 1, we talked about how the origin is normally on the immovable bone and the insertion is normally on the movable bone. So the question here is, what bone does the masseter and temporalis move? They both help move the mandible. When we look at the sternocleidomastoid, we see that the origin is on the manubrium of the sternum and the medial portion of the clavicle. The insertion is on the mastoid process of the temporal bone. So again, when we move our head, the head is what's moving, not the actual clavicle, or not the actual clavicle and sternum. The head is what's moving in those directions. Now, the unpaired action are when we move up from side to side or we turn the head. The paired action is when we pull down our chin to our chest and they work together. So you have lateral flexion, you have lateral rotation, and then you have just what we call flexion. So what bones do the sternocleidomastoid move? They're going to allow the movement of the cervical vertebrae because that's what they cover. Okay, so they're going to allow for the cervical vertebrae to move the actual head. So muscles that act on the abdominal wall, we're going to go superficial to deep. One of the most superficial are the rectus abdominis. Okay, these are going to create the 6-pack and technically an 8-pack if you're really looking at the structure. Okay, so that's the rectus abdominis. We do see then you have what we call the external obliques. We know they're obliques because they are running at an angle. If you remove the external obliques, you can see the internal obliques. And you can also see the transverse abdominis. Okay, these are going to be the deepest. Now, the linea alba is the white line that runs down the midline, and this is a tendon, and this is going to extend from the xiphoid process all the way down to the pubic symphysis. We also see up here that's going to be the external obliques that have been removed so that you can see the deeper muscles. So this is going to be 3 layers of muscles that are around the abdomen. The fascicles are arranged in different directions, and the reason for this is to offer protection to your abdominal organs. Because there's no bones there to help with protection, these abdominal organs are going to be protected by these multiple layers of muscle. So with the rectus abdominis, guys, these extend the entire length of the anterior abdominal wall. They are covered by an aponeurosis. The hypertrophy of these tendinous intersections that are between the different parts of the rectus abdominis give you the appearance of that 6-pack that we talk about. The origin is on the pubic crest and the insertion is on the xiphoid process, as well as the costal cartilage of ribs 5 through 7. So actions of the abdominal wall is going to compress the abdomen. This generates an intra-abdominal pressure. This is going to aid in defecation, urination, and childbirthing. That's why we have that pushing process that happens using your abdominal muscles. We also see that these muscles are going to help you flex your vertebral column. Okay, except of course the transverse abdominis is not going to help with that. It also is going to allow for lateral flexion of the spine and rotation of your vertebral column. This is going to be the obliques. That's why you have that rotation machine to work your abs at the gym. It's going to be done by those obliques. So when we say these movements are done by these muscles, what movements are these? So when you are going to be bending forward, that is a type of flexion. When we go from side to side, that's lateral flexion. And then we also have the rotation. These are done by the different abdominal muscles. So an inguinal hernia is a protrusion of the small intestines through the abdominal wall, and this is where the abdominal muscles have gotten weak and the intestines actually comes out. It's felt as a lump underneath the skin, and this is most common in males, but this does require surgical repair. They have to place the intestines back where it's supposed to go, and then they have to reinforce that weakened area, and they normally do this by inserting a type of mesh. All right, so now let's talk about the muscles used in breathing. When we are going to breathe in, inhalation, the thoracic cavity has to increase in size. And this is what happens when you take that deep breath in. It's going to increase the chest cavity. In exhalation or breathing out, the thoracic cavity needs to decrease in size. So when we look at this, there's muscles that are going to help do both of these different types of movements. So in inhalation, we see that the external intercostals are going to contract and the diaphragm is going to contract and push downward. In exhalation, the internal intercostals will contract and the diaphragm will relax, decreasing the size of the rib cage. These muscles are attached to the ribs and they change the size of your thoracic cavity by pulling them or allowing them to be drawn inward. Additional muscles are used during forceful inhalation or exhalation. We could use the sternocleidomastoid, your oblique muscles, and some of your abdominal muscles as well. The diaphragm, guys, is the muscle that powers your breathing. It's a dome-shaped muscle that's going to separate your thoracic cavity from your abdominal cavity, and it's going to be able to push down, which makes your thoracic cavity larger when you breathe in, and it's going to balloon or push up whenever it relaxes in order for you to breathe out. It does contain some various openings. These are called hiatus. They are going to be structures that they're going to be holes to allow structures to pass through. So like the esophagus, the vena cava, the aorta, they all need to be able to extend down from the thoracic cavity to the abdominal cavity. And so because of this, they have to pass through the diaphragm to do so. So when we talk about a hiatal hernia is when the stomach protrudes up this hole that the esophagus normally is going to travel through. So guys, anytime we talk about a hernia, it's being where something is being pushed into a place it shouldn't. And so in this case, it's the stomach protruding up past the diaphragm into the thoracic cavity. All right, the external intercostals are going to help with inhalation. They're going to elevate your ribs and expand the size of your thoracic cage or cavity. The internal intercostals are going to depress the ribs and decrease the size of the thoracic cavity. Now, intercostal fibers run at right angles of each other, so their insertions and origins are going to be opposite. Okay, since they do the opposite action, we say that they're going to pull in opposite directions. All right, so now let's look at muscles that move the pectoral girdle or your shoulder. These muscles insert on the clavicle or the scapula, and the main action of these muscles are to stabilize the scapula for the arm muscles. So the first one we see here is the serratus anterior. This is going to help abduct the scapula. It's going to be a flat and fanned out shape, and if you'll notice, it has the serrated edges. The origins on the ribs and the insertions on the scapula. This muscle is also termed a lot of times as the boxer's muscle, because when you box and you do like a hook type of punch, it's going to cause your scapula to abduct, go out to the side. All right, and so this is why a lot of times it's called the boxing muscle. We see the trapezius is going to be the posterior backside, and it's going to elevate and depress, and it's going to adduct your scapula. So it's the opposite. Okay, it's going to pull the scapulas in towards the vertebrae. All right, and this also allows you to extend your head. It's a large, flat, most superficial muscle that's on the back of your neck and trunk. Okay, and so we work a lot of times our traps when we end up doing kind of a pull down in a sense. Okay, and we fill that up in the traps area, and it also is going to allow you to extend the head backwards. Now, muscles that move the pectoral girdle or the shoulder are your rotator cuff muscles. There's what we call the subscapularis, the supraspinatus, the infraspinatus, and the tres minor. These muscles join to the scapula and the humerus, and their tendons form a circle around the shoulder joint, and this is what causes that cuff that we talk about as being the rotator cuff. Okay, so this is going to be the back side that you see here, posterior, and then you have the anterior side. A lot of times when we have rotator cuff injuries, some of these tendons have been torn and they need to be actually surgically repaired. Now, muscles that move the humerus, your actual arm, which means the insertion of these muscles are going to be on the humerus. We have what we call the pectoralis major. This is going to be an axial muscle on the front side of your body, and it's going to cause adduction of and medially rotation of your arm, so pulling your arm in and also rotating it in. The pecs are going to help with this, and it's also going to allow you to flex your shoulder, so moving up with flexion. All right, and so that's going to be where the pecs come in to help. Now, if you'll notice, this pectoralis major does connect on the humerus. We also see that you have the Latissimus Dorsi. This is an axial muscle as well, but it's found on your back. It's a very large muscle on your back. We see that it is going to allow you to adduct and medially rotate your arm. All right, so it's going to allow you to adduct. Also, it's going to allow you to rotate. This is also going to help you extend your shoulders, so going back. All right, and so the Latissimus Dorsi, and you can see it's located here. The deltoid is going to help with it's going to be a scapular muscle. This helps form your shoulder mass. We see that it's going to help you abduct and medially rotate your arm. All right, so it's going to help you with abduction as well. We see that it is also going to help you flex and extend your arm at the shoulder. All right, so it's going to help you with flexion and extension. So going forward and going back, the deltoid is going to help with this. Now, the origin of the deltoid is on the clavicle and scapula, specifically on the acromion process and spine of the scapula. We also see that it's going to have the insertion on the deltoid tuberosity that's found on the humerus. Now, guys, remember the deltoid looks like a triangle here. And guys, normally when we get shots in our arm, this is the muscle they put it in, is the deltoid. All right, so here's like a little quiz that says name this muscle. Okay, so if we're pointing right here, this is the pectoralis major. Okay, the next one, when we're looking at the shoulder itself, this is the deltoid. Okay, this one, if you'll notice, it has that serrated type structure, so this is the Serratus Anterior. On the back, you have the trapezius, and then you also have the deltoid again that you can see, and the Latissimus Dorsi. All right, so now let's talk about the muscles that move the radius and the ulna, which are your forearm. These muscles are located in the upper arm, running along your humerus. The anterior muscles, which are the front, are going to flex your forearm, and the posterior muscles on the back are going to extend your forearm. Okay, so the first one we want to look at is the triceps brachii. It's in the back, it's in the posterior part, so it is going to extend your forearm at the elbow. Its insertion is on the ulna, that olecranon process that we talked about on the back. That's going to be where that insertion is, and that's why it helps move your elbow, extending it. The biceps brachii is on the front or anterior portion. This is going to help you flex your forearm at the elbow. Okay, this is also going to help you supinate your forearm. So you have, remember, supinations with your palm up. And its insertion is going to be on the radial tuberosity. Okay, so remember that radial tuberosity is that rough spot on the radius. This is where it's going to attach. Now, if the proximal bicep tendon ruptures, the tendon that's holding it at the top part of the muscle of the shoulder, if it ruptures, this creates what we call a Popeye's muscle, which you can see here, and that is not normal. Those tendons should be holding it stationary up there on the shoulder area. Okay, muscles again that move the radius and ulna. Another one is called the brachioradialis. This one's going to help you flex your forearm as well. It's going to help you supinate and pronate your forearm. And so a lot of times if you will supinate, okay, and you can feel the brachius radialis when you are supinating and pronating. The insertion is on the radial styloid process. So it's way down here on that styloid that's down here by your thumb. Okay, that's where the insertion is located for the brachioradialis. All right, muscles that move the wrist, hand, and fingers. These are muscles located in your forearm. The anterior front muscles are going to flex your wrist, and so these are going to be the flexor carpi radialis. They're going to also help you abduct your wrist. The flexor carpi ulnaris is going to help you adduct your wrist, okay, because remember the radius runs to the thumb, the ulna runs to the pinky. We also see that you have the flexor digitorum superficialis. These are going to help you flex your fingers as well. And then you have the palmaris longus. This is going to weakly flex your wrist, okay? It's going to be a very weak muscle. All right, if you'll notice, all these insertions are going to be in the hand region. Now, golfer's elbow is when we see a strain in these flexor muscles. All right, so we see a strain in these muscles here in the forearm when we talk about golfer's elbow. On the posterior side of the forearm, you're going to find the muscles that extend the wrist. This is going to be the extensor carpi radialis, again running towards the thumb, and it's going to also help you still abduct, okay, moving your wrist away in abduction. We also see the extensor carpi ulnaris, which is going to help with adduction, and the extensor digitorum, which is going to help you extend your fingers. Okay, their origin is on the lateral epicondyle of the humerus, and their insertions will vary, okay, down in the hand region. All right, moving on down into the leg, let's talk about the muscles that move the thigh or the femur. These muscles are larger muscles and more powerful than the arm muscles that we just talked about. So the first one is the gluteus maximus. The gluteus maximus is going to help you extend the thigh at the hip. So it's going to allow you to be able to straighten your leg. It also helps you rotate your thigh laterally, so out to the side, and its insertion is found on the femur. The gluteus medius is going to help you abduct the thigh at the hip, and it also helps you rotate your thigh at the hip. Its insertion is also on the femur, and it's going to be inserted on that greater trochanter that we learned as that marking on the femur. So the tensor fascia latae is best viewed from the front side of the body. It's going to help flex the thigh at the hip, and it's also going to help abduct the thigh. Its insertion is down on the tibia on the lateral condyle. All right, and you can see it's a very thin muscle or a very small muscle, but has a long tendon that connects it down to the tibia. Okay, so you can see it better on the anterior side, the front side of the leg. The gracilis is going to help you flex the leg at the knee. It's also going to help, So now let's talk about the muscles that move the leg, the tibia and fibula. The first one is the gracilis. It's going to help flex the leg at the knee. It's also going to help you medially rotate your thigh. And it's going to adduct the thigh at the hip, so being able to pull the leg inward towards the body. Okay, we talk about the gracilis, guys. This is that growing muscle, the groin muscle. When somebody say, oh, I've pulled my groin, normally it's the gracilis that they're talking about. The Sartorius is the longest muscle in the body. It's going to help flex the leg at the knee. It flexes and laterally rotates the thigh, and it's known as the Taylor's muscle. Okay, the Taylor's muscle. You can see it running down the leg here, but it is going to be the muscle that allows you to cross your legs. All right, so this is going to be the muscle that allows you to cross your legs. The hamstrings are on the posterior side. Their insertion is going to be on the tibia. They are going to help flex the leg at the knee. They are also going to help extend the thigh at the hip. This is three muscles working together. So these hamstrings are going to be the biceps femoris, the semitendinosus, and the semimembranosus. So these are the three muscles that make up the hamstring, the back side of the leg. We see the opposite, the anterior side of the leg is going to have the quadriceps. This is going to help extend the leg at the knee. Now, there are four muscles here. That's what the quad tells you. We have the rectus femoris. The rectus femoris also helps flex the thigh at the hip. So you have the rectus femoris. You have the vastus lateralis, the vastus medialis, and then there's the vastus intermedius. Now, this is going to be behind the rectus femoris. So you can't actually see it in the picture here because those other muscles are covering it, but it is going to be between the vastus lateralis and the vastus medialis. All right, so again, here's a little quiz about naming the muscle. Okay, so when we're looking right here, this groin area muscle is the gracilis. Okay, the one that comes across the body is going to be what we call that Taylor's muscle. That's the Sartorius. Okay, the one on the side is going to be that tensor fascia latae. This is also on the side, so this is the vastus lateralis. The middle is going to be the rectus femoris, and the internal one is going to be the vastus medialis. All right, so now let's look at muscles that move the foot and the toes. So you have the tibialis anterior, which is towards the front, and then you have the fibularis, or we call the peroneus longus, which is going to be on the lateral side of the foot. So when we look at this tibialis anterior, it's going to dorsiflex the foot, so pulling the toes up, whereas the fibularis longus is going to help with plantar flexing, the opposite of pulling the toes down. We also see that the tibialis anterior is going to invert the foot, whereas the fibularis longus is going to evert the foot. So they do opposite movements. So the tibialis anterior and fibularis longus, if they do opposite movements, are they synergist or antagonistic? They are antagonists. We also have the gastrocnemius. This is on the posterior side of the calf. We see that the gastrocnemius is going to be on the posterior part of the leg. Okay, we also have the soleus, which is found on the posterior part. When we look at the gastroc is a lot of times known as your calf muscle, and the soleus is a little bit deeper. Now the gastroc is going to help plantar flex the foot, and so is the soleus. So they're going to do the same movement where we're going to see them help point the toes. However, the gastroc is also going to help flex the knee. All right, so the gastroc is also going to help with knee flexion. So the fibularis longus, the gastrocnemius, and the soleus, they all do the same movement of plantar flexion. Therefore, are they synergists or antagonists? They would be synergists because they do the same movement of plantar flexion. What bone are the gastrocnemius and the soleus inserted via the Achilles tendon? So if you look here, we see that it's inserting down into the Achilles tendon onto the heel. The bone that makes up your heel is the calcaneus. Now, plantar fasciitis, guys, is inflammation of the plantar aponeurosis, that tendon, and it most commonly causes heel pain in runners. Okay, so plantar fasciitis is going to be where they will have pain due to that tendon being inflamed, and it's going to cause pain a lot of times in the heel. All right, so again, let's look at this whole idea of naming the muscle. All right, so when we're looking here, this is what we would call the gastrocnemius. You can see it on multiple angles. You can see it from the back posterior view, the anterior view, and the lateral view. Okay, we also see that it's going to be held in place by this tendon, which is the Achilles tendon. Okay, this next area is on the front part of the leg. This is going to be the tibialis anterior. Okay. We also see that it's a little deeper to the gastroc. That's going to be the soleus. And in between the soleus and the tibialis anterior is going to be the fibularis longus. So these are the muscles you need to know in that lower part of the leg.